My name's Dr. William Lum. I'm a GP, but I'm also Chief Clinical Information Officer for NHS Cumbria CCG. Whatever the politics or however you organise healthcare, there's a fundamental move towards fragmentation of services. So for any health economy to succeed, you've got to manage that, and you've got to be able to cope with that. And by coping with it, you get your efficiencies. You get your cost control, because otherwise costs will just will spiral. So Cumbria recognised that. We've been on the journey now. Formally, we've known about Strata for several years. The reality is we've started on the journey over the past 18 months, 2 years with them. So we've started that process of pulling all the stakeholders together. So that I've already referenced the two acute hospital trusts. Both those are on board. We have our community service providers also on board. So adult social care is on board already. And then we're expanding this into the ambulance service, into children's social services, into primary care, and also into the third sector.
As an organisation, we've been using Strata since July 2013, and we refer to Strata at the minute as Phase 1, and that Phase 1 is a care type for referrals into adult social care. So in comparison to, before Strata was implemented, we would use a 4-page written contact assessment, and it was quite time consuming for frontline staff being the nurses on the ward. And once that contact assessment was completed about the detail you thought you needed to provide social care, you would then fax that referral into social care. And then really you would just assume that it would be picked up at the other end and acted upon. That wasn't always the case, and it proved that there were quite a lot of delays attached to that. So by using Strata, a computerised referral system, it's quick and it's easy to use, and you can use it at any time of the day, knowing that there'll be an accurate trail of when these referrals were sent, when they were picked up, when they were acted on, and then consequently as a result of the assessment and a discharge plan when the patient was discharged home.
Prior to Strata being implemented, we used to receive referrals for hospital discharges through faxes or emails, and sometimes by telephone calls, which was quite a disorganised process really. Within that process, referrals used to get lost. We didn't know whether practitioners, as in social workers, had picked those referrals up, or whether we hadn't received them, or quite what had gone wrong. The Strata system identifies every single action within that referral process. So we know when it's referred to us, we know when it's been picked up by a practitioner, we know when support's being put in place. So if there's any errors that take place, we can immediately identify what those errors were and fix them.
I've been part of the Strata super user group for Cumbria Adult Social Care, where we've worked to introduce Strata into the teams and get it up and running really. So at the moment in Copeland, we're receiving referrals via Strata from the district nurses and from non-inpatient services such as OTs and physios. We're due to go live with the hospital in July. Prior to Strata, we would have accepted referrals via paper form or telephone, whereas now we will insist that Strata is used. This has been quite useful because it's a storage system, so we can look back at the referrals, and it's particularly useful if there's a dispute because it's a written record.
It was quite a big change at the time. There was a lot of work involved, there was a lot of communication that was needed to ensure everybody knew where we were and where we were going with this new referral.
We used to spend one morning every week at a meeting between the hospital and social services, looking through those difficulties, and in essence that was about apportioning blame to individuals, whereas Strata now lets us identify what the problem is very, very quickly, fix the problem without blame as to who caused that issue, fix that problem and move forward. It's changed the relationship considerably, makes working life easier and less contentious.
Like with every change, you not only need to implement the change, but you need to ensure that it can be sustained and it can be spread. But with Strata, it's successfully been that it's become normal working for frontline staff, which is great.
So an area for improvement in the future, I think, would be to facilitate referral from OT to OT. At the moment, the hospital OTs will issue equipment and then fax the information through for us to do an annual review. If there was a facility on Strata to make that referral and attach the documents, I think it would make a much smoother process, and also provide a system where it's more accountable. So we know the referral's been made, we can then transfer it through to our system. So I think that's maybe an area for development in the future.
So we're on a journey that we think will take us 2 years to get to where we want to be, and the mature vision is a 27/365 service where we have professionals making assessments using their native systems, whatever those native systems are, making decisions about levels of care, and then feeding automatically and painlessly feeding those requirements into Strata, and basically giving us a real-time dynamic, interoperable directory of services that then manages patient flows. So almost any time, any place, anywhere, Strata will take that referral and will direct the patient to the right place.
Using Strata has naturally, I think, brought us together as a team, and by a team I don't just mean the organisation, I mean health and social care, and it's brought us together and we communicate a lot more, whereas before Strata it was that paper referral system. We just, like I explained earlier, just assumed it was sent, the social worker would attend the ward, and there wouldn't be that key link with that communication as there is now. Strata's in place.
The hospital staff, given the size of the hospital, a lot of their staff seem to have found it more difficult to pick up the process. And there's still ongoing issues there that we communicate on a daily basis to resolve. But because there's such clarity in the process, it's easy to very quickly identify what's not working and then get an agreement to fix it.
I think the transition from paper to electronic referrals, we knew it was coming, so we were prepared for it. There were appropriate communications internally, so staff were fully aware of what was going to be expected of them. And Strata provided training from the company, so they were on site, so they were on hand, and every ward had a super user. So once that super user was trained, they were enabled to then continue that training with the ward staff. So the transition wasn't particularly slow because, again, like I said, we were prepared for it taking place. So we were just able to move with it.
We've looked into Strata as a way of integrating health and social care, and I think it's improved communication between social care and health, and hopefully it will do in the future.
We have a group of dedicated Strata workers who spend the majority of their time in the hospital. So as soon as those Strata referrals come through, we can respond to them immediately. And there's very clear process, meaning that those people have their needs readily and quickly identified. We get the right support in place for them and have them at home as soon as we possibly can.
It's a quick and easy electronic referral to use. The training I've noticed that staff have needed, if they're not as computer literate as the next person, would be how we get into Strata via the Lorenzo system that we currently use. But internally we have training to support that.